You hear the thunder? Hi, everyone. Welcome to this week's live. All right, so as usual, someone let you know that you can hear me. And two, if I suddenly am completely gone, it's because we're having a thunderstorm right now, and the power might just shut off. So that would be fun. And other disclaimers is Piper's transitioning to a new pacifier, and it's not going well. She's on the other side of this wall, so we might also have that going on. But Joe's right over there, so he might go safer. Welcome, everyone. If you're new, welcome. If you're watching this on like the playback thing, I'm Liz. I'm a family nurse practitioner. And during these lives, we just go over like a topic, which today is going to be clinical during COVID. And then we'll just do a Q&A after. And it looks like a ton of you are already here and have a bunch of questions. So hi, everybody. Welcome. So we will dive straight into this whole conversation. I don't have any phenomenal, like super insightful tips about this. I'll be really honest. I came up with like a few things that might be helpful, but I'm getting so many messages from you guys saying like you're in nursing school or you're in NP school and you're dealing with clinical. And it's a lot. So whatever you guys are experiencing too, just like feel free to chat and like let each other know in the chat, because I think that's super helpful, because I'm obviously not in clinical right now, so I don't have like all the know-how. We do have an NP student who is going to be starting next week, so I can kind of tell you what we're going to be doing with them. But Megan Doss, wait, let's wash our hands first. Oh my gosh, it's so true. But we can just kind of talk about it. So first, I thought we'd talk about nursing school. So nursing school, a lot of schools are doing clinical online or they're canceling it. This seems to kind of vary based on where you live. And the biggest thing I can tell you about this is in a lot, like, it sounds really bad, but like nursing school clinical is not intensely useful. Yes, you do learn some skills in it. However, the way nursing school clinical is set up is it's very disjointed. And you don't learn nearly as much as you could if you had more of a fluid experience. Like your preceptorship in nursing school, I feel like is where you learn the most, because you're paired with one or two people and they know where you're at and you know where they, like, you can really become more of a team and move on. Whereas most of nursing school isn't like that, and it's really disjointed. So I don't want you feeling like you're missing out on this phenomenal experience that you were like you're missing out on this huge thing. Because yes, you do learn things at clinical and you learn skills, but honestly, a lot of the times you're paired with nurses who don't want you there. So you're not missing this epically wonderful thing. And I know that sounds bad. I just think that's a huge room for improvement for nursing school in general. So if you're not going at all, like, yes, very much not ideal. However, like, not the end of the world. I also think that on the other end of it, employers are going to have to understand this and like work with you. You learn most of your actual nursing skills at your first nursing job. I'm sure you've heard that all over, and it's really, really true. You come in with a base knowledge, but I would say like even things that I thought I learned, like I learned how in nursing school to, like hang this IV bag. It ended up being a totally different system at my actual job. So like some skills, major skills translate, but you know what I mean? Like you're going to learn most of your nursing skills at your first job. The hospitals are going to have to acknowledge that you might need a little bit more help. And in that area, the biggest thing I could tell you is just really know that you're going to need to advocate for yourself. In terms of getting your first job and saying like, hey, like this wouldn't be something I would ever like lie about. Just like, hey, like, the whole coronavirus thing happened and all of my clinical, like a lot of my clinical was online. Here's the skills that I have. And like, that you've learned through whatever school and whatever clinical you did have. And have that in your back pocket. Have an awesome resume. If you guys need resumes, at the Resume RX is a phenomenal resume resource. I have a code for 20% off, and it's Nurse Liz, just like my name. You can message me later if you need it on Instagram or somewhere. But I think having an awesome resume and knowing your strengths and what you have going into it and knowing how to advocate for yourself are going to be the most helpful things. And that's kind of all I have to say about like, in terms of nursing clinical. I think it's going to be really touch and go. It's going to be, I guess that's not all I have to say. I think it's going to be really touch and go in terms of if your hospital is allowing people to come in. If they're being hit really hard, you're not going to want to be there anyway. and they're not going to want to share their PPE with you. It's not going to be a learning environment. You know what I mean? And the whole point of clinical is to learn. So if you're I've had a couple messages from people saying they were getting shut out of clinical and they thought it was really unfair, like that the hospital is saying no. But I would encourage you to look at it from the perspective of like, that's not gonna be a good learning environment. You know what I mean? Like you don't want to be there. So if you have any other questions kind of related to any of this, feel free to leave them and then I'll try to scroll through after we chat. But that's my biggest thing for nursing clinical is you're going to advocate for yourself. And it really will, like, they're going to have to learn to deal with it. You know what I mean? Because there's a whole class of nursing school students who are in your same boat. Okay. NP school. In clinical. This is a very different beast because your employer is going to expect you to come out of school fully prepared to practice essentially independently. I've talked about it on here before, but I got 4 hours of orientation where I kind of followed her around and learned the computer as fast as I could. And then I worked with her, but there is no, like, you're expected to pop out of NP school clinical ready to go. I was trying to make an analogy in my head of like fully baked baby. And then it was like, I don't know, I was trying to think of an animal that comes out more fully cooked, maybe a reptile. I don't know. It went south. I can't come up with those things on the fly. But so that's different from nursing school because you're not going to get that same training. And I mean, maybe you can, and you can advocate for yourself, but the market it's less forgiving in that aspect because it's harder to usually get like a new NP job versus a new nurse job. So you're fighting a different fight. With NP school, so this is another one. I've had a lot of people message me saying that either their placements have been totally canceled or it's just been like most people saying like it's a mess. My placement's canceled, all of this. So I do have a video on finding NP clinical if you need to do like just find a new clinical site. I think you're really going to have to market yourself as almost like what can you do to benefit the clinic in this way? You know what I mean? Because students, I mean, by their nature, just kind of slow things down and that's okay. I mean, it's okay. You're a student, you're learning, but you need to, especially in this insane era, try to like mention the positives of like what you could maybe like bring to the practice. As hard as that sounds, like maybe, try to niche in that way, if that makes any sense. Other things that are going to be helpful. So, because Caitlin says she's doing like cold park calls at this point. It is so hard. And I feel so bad for students. And I also feel it from like a provider, like my perspective. So, and it's a really hard like thing to kind of toe and balance because we canceled our student for the last semester and I felt super bad about it. And the woman I work with did too, but you have to kind of look at it as like, this is your learning experience. And since you are expected to pop out fully done, it's not going to be like, it might, if they're canceling on you, it's probably because it's not going to be a good learning environment. Like we told her, we're so sorry, we can't do this because we were both almost in tears every day trying to figure out how to do telemedicine. Like there was no way that anyone who was with us was going to learn anything. Now going forward, we're going to implement it where like they're going to come in, and we're going to kind of take it like day by day. We haven't, I think cold and flu season is going to be like a whole different mess because of like PPE and like, what are we even doing? We haven't figured out what we're doing for cold and flu season yet. But we're going to have the person come in and then we're not sure if they're going to see maybe some people in clinic, but the primary thing I think they're going to do is sit with us and we can all be in the same room during a telemedicine call. And I think that'll be the biggest way. So if the office you're trying to get into does telemedicine, I think that'll be the easiest thing because then you can obviously just like sit in with the call. And also I've prepared a few things for the person to, even if I'm anticipating that a ton of patients might not want to see this person because the more people you see, the more exposed you are. And we have a lot of patients that are really worried about that. So I've kind of worked up a couple, like, here's an example patient, like, let's look at our roster for the day. And then like I want you to take Mr. Roberts here and look at his last note. And then let's pretend he's coming in today and his labs say that his cholesterol is worse. Or what would you do if his blood pressure was high? Or what would you do if he had came in and said that his toe hurt? You know what I mean? And to try to give some learning experiences through that. So that's something you could also advocate for yourself for if you're already in a clinical placement, to say, hey, maybe a ton of patients don't want to see me, but ask the person you're precepting with, could you do that, like fake patient scenarios, but in a real center based in a real patient, like in a real situation based on real patients, and kind of talk through it with the provider. So that's something that you could always do, and that I'm going to do with her, because I've already run into it at work where people are like, I know you always have students and I'm not seeing any of them. And I'm like, okay. But telemedicine is going to be really good for that too, because we'll all be in the same room and the patient won't have to repeat anything. So I'm almost excited for that, because I feel like that's going to bridge the whole, like, hey, we have a patient, we have a student, would you mind talking to them? I'm going to be right here. So you are not going to need to repeat yourself twice. I'm just going to creep out of frame over here, so it seems like you're one-on-one. And then you can almost interject, like if you need to, when the student hits the end of their thought, as long as, and like do a little bit of like course correction, obviously without embarrassing the student, to kind of say like, oh, like I'm also going to ask you these things in my HPI. You know what I mean? So I think that does offer a big benefit if the office you're doing is telemedicine. So those are kind of all things of how to sort of like ease the situation. But honestly, guys, I don't have a ton of advice in terms of all this. This just stinks. And I know it's going to totally stink to like everybody who's like education course is just going to get totally skewed by this. And it's just a mess. And said, I don't understand how it's your responsibility to find clinical placements. It is ridiculous, guys, that nurse practitioner students are supposed to, at most schools, find their own clinical placements. It is just, I mean, it's mind blowing. My school, one of the reasons I chose it was because they chose my clinical placements. I don't understand how you're supposed to like do the school thing and like on top of all that stress find a preceptor. Also, that means that you don't know that preceptor necessarily. And it's just, that whole thing is just such a mess. I also don't know what you're paying for at that point, because they like people don't seem to teach really well in a lot of nursing school in general. There's not like a great, usually, foundation of education. So like if you're not really providing me with lectures, you're just saying, here, go read this entire book, and you're not finding me preceptors, and you're monitoring a discussion board, like, why am I paying you tens of thousands of dollars? Anyway, you can kind of tell I'm really cranky about that. And I don't understand it. Most other schools, like medical school, NPA school, and also NP schools, like you don't get money to be a preceptor of an NP student, whereas with, I'm pretty sure PA students, I know for sure medical students, you get paid. And so that also like double plays into, not only you have to find your own preceptor, but you have to find a preceptor who is willing to precept you without getting any money. I mean, some organizations do, like there's different NP placement finders that you can pay the organization and then they'll pay the NP. And it's just, but yeah, it's incredibly frustrating and awful. And I'm really sorry for all of you who are dealing with that right now. I just feel so bad. I'm so sorry. Kurt said, I hate it when the doctor needs to be there to see what's wrong with you. I hate it. The doctor needs to be there to see what's wrong with you. Oh, for telemedicine? Yeah, probably. All right. Joe Pittman, I hate that NP students are looked as second-class students as compared to medical students. And it's because they get paid to have medical students. So it is hard. I mean, like it takes a lot of like, just looking at it, it's been interesting to look at it from this end too. Because it takes a lot of time to precept someone. And if you're not getting paid any extra for it, especially if your operation is based on like RVUs, which is where your income is directly based on how much kind of like revenue and how much productivity you have. Mine is not. So I have much more flexibility in terms of taking students, because at the bottom line, like, yeah, I might be like running a little bit behind, but like, if you're income based, like that's why people don't want to take students, is because there's no, I mean, not that everything's about money, but for a lot of people, like if it's going to make you make less money and it's going to be like challenging. It's just a mess. Like NP schools need to pay their preceptors and they need to find them, because you also don't know the quality of the preceptor if the student is finding them. You know what I mean? Like I cannot even fathom. Okay. I am NP Hub priced me about $700 for 12 hours a week for 6 weeks. Oh, that is expensive. In addition to your, what you're already paying for school. And again, what are you even paying for? Anyone else? Okay. Let me scroll back to the beginning. So there's my not very helpful chat about that, but there we go. That's what we have. That's what we have going on there. All right, I'm going to scroll back to the beginning and see what we have going on here. So Short and Nerdy had said her friend is nursing school and with like a sick family with chronic conditions, nervous about going into clinical in the hospital with COVID. I think this isn't going to sound, if she's planning on becoming a nurse, she's going to be exposed to it at some point. You know, this is not going away. It's not going to go away for a long time. So I think it's totally fine to say that this is the point of like, maybe I want to bounce. And there's nothing wrong with saying, maybe I want to bounce, because I think all of us, if we're being honest, when we've been sitting in this situation, have thought, I don't know if I want to do this and expose myself to a coronavirus all the time, or a pandemic, or whatever the next one is after that. Like, I know I have thought that, like, do I really want to do this? Like, especially with like, now that we're seeing patients in the office again, like, do I want to expose myself to this all the time? And my family's not, like, no one in my family is even immunocompromised. So I don't think I've seen this whole like hero thing that they're doing on healthcare workers. One, I think is manipulative, because it makes you feel like, oh, okay, yeah, like this is fine. Two, no one's treating you like, they say you're, I don't know, they're putting the title of like, oh, you're a healthcare hero. And then you treat everyone like garbage, and then no one will wear masks. I'm like, well, then you could at least like wear masks to protect your country and everyone around you, or like give us PPE, but side tangent, find us preceptors. So I think this is for a lot of people going into it who are in training, I've gotten a lot of messages like that. Like, I'm worried about it being exposed at clinical. You're going to be exposed when you get to your real job, whether you work in the hospital, whether you work in hospice, home health, outpatient, like this is not going away. And so I think this is a point where we all need to just sit and say, do I want to do this? And it is okay. It is okay to say nope, because there's not, where the healthcare system and the whole mess of everything has kind of showed us that healthcare workers are not valued, so they're not protected. And so that's kind of what you have to know going into it. And I don't know if this was happening, I'll be really honest, when I was in nursing school, if I would have like kept going. You know what I mean? To say like, ooh, I think it's been pointing out a lot of the holes in our, like, just how we treat healthcare workers. I'm not trying to like say everyone quit now, but you know what I mean? Like, you have to decide what you're comfortable with, and that this isn't going away. So that's what I would have that person do, is like really just sit and have a heart to heart and think like, is this what I really, really, really want to do? There's lots of awesome aspects of working in healthcare and being a nurse and being a nurse practitioner, but there is apparently now this other risk that no one knew about that we all are going to be living with. So that might not make people happy, but that's kind of how I think about it. One crazy nurse said, hi, Liz, I'm in Ohio and our government just made masks mandatory statewide for all public places. Very few exceptions. We're getting a lot of pushback on this, even from other healthcare professionals. Yeah. North Carolina, it's also technically, we also just did that, and everyone is pushing back like crazy and asking for notes. I'm like, no. And it's been a mess. Probably also contributing to me being like, I want to be done. I want to be done today. Caitlin said, in my FNP program, and all have been displaced from clinicals since April. I feel like I'm just lost without this experience. That is so hard. I am sorry. Caitlin said, I just watched your video where you chatted with your acute care NP friend. I'm wondering if you can describe the different salaries for the different kinds of NPs. You would have to look that up on Glassdoor because I'm honestly not sure. Glassdoor is a really good website to go on to see what different people make in your area. You can just type in the type of job. I am pretty sure acute care NPs would make more than family, but that's all negotiable. It all comes down to your contract. So I'm honestly not sure because I've never, ever looked into their salary, and I haven't asked any of them how much money they make. Katie Eki said, I live in the Bay Area and cases are constantly increasing here. I'm going to my second semester this fall and my program hasn't updated on whether we have clinical or not. Ugh, that is hard. I've seen that a lot of just like a complete lack of communication, and that's really frustrated. Oh, Emily Miller, thank you for the super chat. I'm finalizing my requirements. It feels like too good to be true and students won't be allowed again. I really hope, like I said, I hope they are. And if they're not, honestly, it's not worth the learning environment. It's just not, and it's just not. Good. Starting my clinical this fall, Elms J97 said, how are the clinics doing their isolation precautions for patients coming in with COVID symptoms? This is going to vary place by place, and it's something that everyone is just going to have to figure out kind of for your own institution. It is, that is something we are honestly trying to figure out at my office right now. Because so far we've been able to fairly well, like it's not cold and flu season, so very few people, we've been able to, run out and swab people in their car and do a very brief assessment that way. I'm wearing like an N95 mask. But I think other than like, we're going to have to figure out what are we really going to do? Like, are we going, a lot of people I know are doing like gowns and face shields, and all of that. And so I think that's probably where we'll end up going, is having like full PPE for visits of anyone that might have any symptoms. I know maybe we should be doing that anyway. I don't know. It's so hard. It's so hard to figure out how to implement that because it's so different than our norm. And since we're under, I don't know, it's really, really difficult to kind of, do we need to do that for everyone? Like that seems, we don't have enough PPE to do a new gown and everything for every person. So am I accidentally risking infecting someone else by wearing it in every room? Or I truly don't know. That's what we're trying to work on in our office right now. And it's hard. There's no guidebook for this. And normal offices don't have all this stuff, guys. Like there's not like in the hospital where you're like, oh, let me just throw on my PAPR. Like that's not there. How do you handle patients this is Catherine Shaw, who are requesting exemption notes in the office for masks? Saw this story on Instagram, but now I can't find it. So this is ever evolving. We have, and it's hard in private practice because well, that's a whole different topic for a different day. It's hard. You have to maintain some, you want to keep your patience. So if you have people who are like hard on I want to not wear a mask, how do you really balance being like in me, I'm like, I can't think of anything that would preclude you from wearing a mask. Like, let's treat what's actually going on. Like, does it make you anxious? It might make you really anxious and you might feel like you can't breathe, but you gotta still wear one. I have, there are people, there's not a ton of like diseases, at least that I know of, that would preclude you from wearing a mask. But one thing that a few people did recommend on Instagram was having patients come in and saying like, hey, I hear you. I hear you saying you feel like you can't breathe. So let's come in and I'm going to walk around with me. We have a portable pulse ox in the office. Let's walk around the office for a little while. We'll check your oxygen. And if it dips, okay, then we can have a conversation about that. And kind of going from there. Cause then you're really testing it and you're saying like, wow, you really, I would not anticipate that they wouldn't be able to tolerate, but then you have something concrete rather than just saying like, oh, this person felt like they couldn't breathe, because that is going to open up a whole host of yikes. And so I think that's what we've been doing, is saying like, hey, if you feel that way, please come in. We'll do this little test. We'll walk around the office for like 5-10 minutes and then we'll see. And I think that's a very good objective way of looking at it. And it puts nothing on the patient to say, oh, well, like I'm not making a judgment call. I'm making this is what the numbers say type of call. And then if you're unable to, like if you're saying to me, like you cannot work because you have to wear a mask. Okay, then, well, maybe we need to look into you not working. You know what I mean? Like having those conversations with, it's very tricky. And like private practice is really odd in that way, that I've never worked in a setting like that until I started this job. And it is more keeping people happy sometimes, which, I just love. Sarcasm. Not that I don't like making people happy, but I feel like we should practice evidence-based medicine. And the woman I work with does too. It's just people don't think that. They're like, no, I don't care what that says. This is what I want. And you're like, that's not how this works. Let me see. Evie said that they're a nursing student in New York and their school is asking them to sign a COVID-19 waiver to attend clinical in the fall. I haven't had clinical since March and we're doing VSIM online. That's interesting. So like saying if you get it, it's not their fault. Many student, they wanted to know if other people in other states. Ashley said, hi, I survived my first semester online, but it looks like the fall will also be mostly online. They're pretty hush-hush about the clinical situation, so I'm not optimistic. I'm in Maine and they haven't told us what's happening yet. Oh, their hospital, one of their big hospital systems canceled clinical for the year. It stinks. Guys, I am so sorry. What a mess. I think I'm going back in next quarter. Guys, what a mess. Okay. Lots of people saying they're also worried. Okay, let me scroll down and see. I'm trying to find myself. Hold on. Thanks for hanging with me. Someone said, Callie said that their significant other felt the same way. They heard the whole heroes thing on Facebook. Yeah, that like really, really bothers me. Like really bothers me more than it should. I don't know if anyone that works in healthcare, I mean, maybe if some of you do like enjoy that, I would be interesting to hear it. But I have not heard anyone who was liked that hero term for people working in healthcare right now. Travis said, not a clinical question, but how has COVID-19 affected a hospital setting compared to a doctor's office? I don't know, because I don't work I haven't been in a hospital. I know I'm sure, I don't know. I don't know. I guess we'll leave it at that. Yeah, if anyone has any insight on that, it's at least in our practice, it's been very we are now half telemedicine. It was a horrible scramble to figure out what to do. I think we have, I don't know, I was going to say maybe we have less supplies than a hospital, but I feel like some hospitals don't even have any supplies. It's hard outpatient because you have to make up all your own rules, especially if you're not associated with a hospital system like we're not. That's been the biggest, hardest thing. I really am used to having a big hospital institution come in and make the rules. And I literally wrote our COVID policy and I have zero experience in that. And it's been an adventure. Roll my eyes when someone says healthcare heroes in my hospital or in a commercial. For real. Nursing seemed like such a good idea at the time, Caitlin. That's literally when people are like, why'd you do that? That meme where it was seemed like a good idea at the time. It's my life right now. Just being real. One day I'll remember why especially today, all of my patients I saw today, none of them, their insurance, either they didn't have insurance or they were their deductible was so high that they could not get what they needed. And I just left so mad. I was like, no one wants to wear a mask. Everyone, this is going to last forever. No one can afford any of their medication because insurance, it was not good. And then it was 100 degrees outside. And it was the poor MAs, they were sitting up there. They're like, I'm going to go home and my toddler's going to give me attitude. And they were like, yeah, okay, Liz. Okay. I was not happy. So here we are. Julia Trite said, have you ever had questions about tail coverage? So this is about, malpractice insurance. And you would so the biggest thing I know about tail coverage, you have different types of insurance coverage when you have malpractice insurance. There's one, I forget what the other term is. So there's the one term this is not helpful, that covers you, and think maybe it's incident, and that covers you for while you are actively working there. And then and all the lawsuits or whatever that people would do like while you're working there. And that is almost always something that at least your employer is offering you, or that's the standard, the minimum kind of what malpractice insurance will offer. And then there's something else called tail. And tail is any lawsuits that people would file after you have left the organization that were filed against you for the time while you were there. And you want tail also. So some places like you have to tack your own tail on, or you have to pay more to get tail coverage. Because you want to be covered even if you had left that practice 5 years ago and it's now 5 years later and someone's saying like, hey, you were part of my primary care team and you missed this 5 years ago, they can still sue you for that. So you want tail because it'll cover you that whole time. So definitely get tail with whatever you do have. Acute care, is that critical care nursing? This is Kurt. Acute care is in a hospital setting typically versus like primary care or outpatient care, and that is in like a clinic. Holly McDaniel said, I'm about to start my last semester of school for my BSN. Any advice for new grad nursing in the middle of COVID-19? I'm scared. Go back to the very beginning. And when this one's over, and we kind of talked about like in the very beginning, if you can get a preceptorship, that'll be the best learning experience. And if not, just advocate for yourself. Your job will teach you. Do you pay, they're talking about like the paying an NP. You usually don't. So LJ 97, you usually don't pay. They're asking like, do you pay an NP directly? You usually pay. So some places they will call it I don't even remember. I'm like the least helpful person ever. There's a term for when you're going, honorarium, maybe when you're going to be paying the NP directly to do clinical with them. So that's that, but there's also agencies that you can go through, like NP Hub is one. If you search like NP Placement Finder, you can find them and you hire them and they will help you find someone, and then you pay like a fee per hour. I hate that those things exist, but I mean, they serve and if you're desperate, you need them, but it just makes me so sad. Your mom, Karen, I'm so happy I'm not the only high schooler here trying to gather info, deciding. Good. It's really good to gather a bunch of info before deciding your career. Hi, Anne. Yep, NP Hub, good. Former preceptors aren't accepting students due to relate to COVID, and the school is requiring students to sign a COVID waiver. Claims versus occurrence. There we go. Thanks, Road to AGP and CNP. Wow, I just messed up all those letters. But yes, claims versus occurrence. And one of those has, I think claims would be the ones that would have tail. I would Google that. Look that up. But you always want tail coverage is the moral of the story. Haley said, I work on a unit where the positive COVID patients go. Oh, thank you for doing what you do. That is rough. We are required to have a face shield and mask on in any room, full PPE for positive or suspected cases, no visitors for positives, but one for negatives. Do you have to wear an N95 or is it just a surgical mask? I feel like I would want to wear an N95. I feel like I'm about to switch over to, I've just been wearing at work. If I swab somebody, I obviously put on like we have like plastic, like goggly things, and then an N95. But I feel like, and the rest of the time I just wear a surgical mask into the rooms if they are here for like a physical or something totally unrelated. But I feel like I'm about to switch over to wearing an N95 the whole time at work. Although I did try it makes me nervous about the N95 at work because I was trying to talk in my, like I'm showing you, like everyone knows what an N95 looks like. I was trying to talk, I talk a lot, obviously during these appointments, and I really wasn't able to, I was worried about opening my mouth too much because I realized when I got fit tested, I don't know if I ever opened my mouth, you know what I mean? Cause I didn't necessarily talk a ton when I was in those rooms before. So I don't know, guys, I do not know what to do. If you guys work outpatient, what are you wearing? Or inpatient? I'm very curious to see what. Road to AGCNP. Claims-based is usually offered by employers. Occurrence is more expensive, but covers you while you work there and after you are there, and leave after you leave whenever the claim is filed. Perfect. So claims, occurrence is more expensive. So occurrence would have tail. That. I knew a doctor whose malpractice insurance was $100,000 a year. Yeah, yeah, especially it'll depend on the type of practice you are in. OBGYN's malpractice insurance is probably about that. So that's insanity. Malpractice insurance can be quite expensive. That's a whole different topic, but yeah, it's very expensive. Thank you for all that helpful info, by the way. Honorarium. Yeah, you're helping me out there. Thank you so much. Is being in the ICU for 6 weeks a long time, like as a patient or as a nurse? Claims goes with tail coverage. Thank you. She's helping me out so much. You should probably road to AGP CNP. You should probably just take this over because I feel like you're answering everything already. Do you have a YouTube channel? Because everyone should just go watch it if you do. And if not, please make one because you're answering all the questions way better than I am. Do we need to get, Nurse Nice said, do we need to get tail coverage for students? I'm getting ready to purchase mine soon. Like when you are a student, let me know. My school covered that was like part of my tuition it covered my malpractice insurance. Emma said, I watched the Resume RX talk about nursing jobs that aren't posted online. Is your experience as an RN, did your hospital system hire based on word of mouth or did they use only online postings? So that was first. I love, like, Amanda's just so good at her job and finding all those things. I think it'll just depend on the type of job. My hospital only used, my hospital was different because it was a union. Nurses, my brain is not here. Nursing was unionized at the hospital I worked for. So they had to like legally post every single job online. Because you couldn't, it was like all about bidding for the job. Like everyone had to be able to see it in order to do it. There were some jobs that, like I think you could only see as an internal applicant, but at my hospital, like per whatever our union was, you had to have the job online. I think that becomes different though, when you're looking for jobs, like other hospitals I know are different. Like if you were a nurse, or if you were a nursing assistant, a tech, or a student on a floor, like I have had friends who have gotten hired based on those experiences. And at a different hospital, I was much later offered a job as a nurse where I did my preceptorship as a nursing student. But it was like 8 months later. They called me like 8 months later. They were like, hey, like, do you want this job? I was like, I moved to Michigan because I asked you for a job and I cried and you said no. Maybe because I cried. And now it's 8 months later and now you want me to work for you? I was a little mad. But in those places, like they hadn't posted a job. They just knew they needed that, they were just going to fill it that way. So I do think there are a lot of places where they don't post online, but it'll just depend on the hospital. Surgical, Haley said, surgical masks in regular rooms, N95 and positive or suspected, which makes me wonder how, if everything is suspected, how on earth are you supposed to know? That's what I want to know, like for primary care, because people can show up. Like this is what makes me feel like I should wear an N95 in every single room because it's like, oh, your toe itches, you have a headache, you're sore throat, you feel like you have allergies, you had a fever once, you coughed twice, or you have chest pain intermittent, like every one time you had diarrhea, like, oh yeah, they have coronavirus. Like there's no, how on earth are you supposed to know? Like, so they're like, oh, suspected. I'm like, well, is that everything? So that's what makes me feel like I should just wear one all the time. But then I don't know. That seems that might be very difficult. Let's see. Do RNs need malpractice insurance? Tammy Lay. So you can get it. I'll be honest. I would say yes. I think it's very affordable. I did not know that in malpractice insurance was a thing when I was a nurse, to be fully transparent. I found out much later. I was listening, I think, to the WOMED podcast and they were talking about it. And I was like, wait, what? Apparently it's fairly affordable. And sure, I probably would in hindsight if I knew about it, then yeah, I want to say it's like 70, like it was very reasonable, like $70 for a year. And that would protect you just in case. Again, a benefit of like your hospital is usually going to protect itself. I worked at a unionized hospital, so my hospital like the union really kind of protected you, which benefited nurses, but also like you really couldn't get it was kind of a double-edged sword because like you couldn't really get fired for being terrible at your job. So it protected the people who like made a legitimate mistake, and then it also protected people who were like, and you still work here, like how? But yeah, moral of that story, I probably would if I had known it even existed, which I did not. Just gotta, I would say as long as it's like reasonably priced, but they seem to say that it was fairly reasonably priced. Minty LP said my hospital mandates an N95 for any positive or rule out, otherwise standard surgical mask. I might have already read that. Don't they make you read that paragraph when you get fit? Yeah, but Megan, so when you're reading that, like when you're getting N95 tested, like I remember talking, but I remember talking not nearly like as animatedly or as much as I would, you know what I mean? Like I'm sure I probably talked like this because I just wanted the stupid test to be over. So I was like, let me read this paragraph to you. And I was talking like this. Whereas in real life, I'm going to be talking like this. So I guess all day I could talk like da, 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 da. Also, I have not been fit for 2 years. And I definitely, so that makes me be like, and I don't even know how do you get fit for an N95 if you don't work in a healthcare system? Because like there's no one to test me. You know what I mean? Like I guess I could shove my head in a paper bag or do whatever they do. But I definitely was not. We very rarely had to wear N95s at my old job. And so I'm sure when I did my fit testing, I wasn't talking like I would talk to you or like I would talk to my patients. I'm sure I was like let me just get this over with. I want to go home and go to bed. You know what I mean? Like I did not take my fit testing nearly as seriously as I should have because I almost never had to actually wear it. And I remember one time I did have to wear it. I was going into a suspected TB room and all I was thinking was like, dang it, I probably, did I taste the sweet? And I was just like, nope, I don't taste it. Let me leave. But like I feel like probably should have taken that a little bit more seriously. We get fit tested every 2 years just in case we gain or lose weight in our face. Yes. And my hospital also made you redo it after you like had a baby because things change so much. So we actually had to get checked every year, I think, at a minimum. But again, don't be me. Be honest during that. I mean, I really think I was pretty honest because that scared me, but can't be sure. I always did it like after night shift and I was like, I just want to go home. Like, that's not what I want to do. OR nurse here, this is Catherine Shaw. She said, we do N95 with surgical mask over it, full PPE during intubation or extubation. That makes sense. For inpatient nephrology unit, we wear a gown, surgical mask, face shield, unless it's positive, then N95. Okay, so I guess a face shield could be a thing. I've seen a lot of people with the one that goes like across your forehead and then kind of comes down like that. I feel like that would be maybe a good idea. Road to AGPCNP. Oh, she does have a YouTube channel. Guys, go follow her YouTube channel. If you scroll around in the comments, it's Road to AGPCNP. She's the one who's been answering all these questions for me that I don't know the answer to. So go follow her. She seems to know so much more about what she knows, what's going on than I do. Nurse Nice said, yes, they're making me purchase it as an NP student on my own. Then what are you even paying for school for? Oh my gosh, that makes me so mad. Do you also have to find your own preceptors? Because if that's the case, then they are scamming you. Not scamming, I don't mean this like as you, as a student. Like that is just ridiculous. If you're not going to pay for the malpractice insurance, yikers. Wear the N95 all the time because you never know who has it. I know. That's what I'm feeling like I need to do. And then I'm like, will it even fit my face with the way I need to talk? Maybe I can't talk. I don't know. What a mess. I work on a cardiac and neuro floor. If they have surgery, they get tested for it. Right. Let me see. But every CPR is treated as a positive, so they have to leave the room and don PPE before going in and doing the code. Oh, that's interesting. That makes sense because then you're aerosolizing everything. Nurse Nice says, I'm a hospice nurse, so I'm always in close spaces with families and patients. And of course, most don't wear masks. So I wear 2 surgical masks because we don't have enough N95 everywhere. Yeah. And yeah, I don't blame you. I feel like that would, oh, that's a mess again. But let's call everyone a hero, but let's not be able to give anyone the proper protective equipment. But you're a hero. I'm grumpy. I'm sorry. Occupational health nurses may be able to do the N95 test in the community. Yeah, I don't even know how to find one. I guess I could Google that. That's probably right. In clinicals on a COVID floor, we were paper masks and we get a face shield tomorrow. You can wear an N95 if you have one. Oh, that's a mess. I am sorry. Sunny Sangi said we only get to do either Gero versus mental health as a first year incoming student. Which one would you choose? Totally depends on what you want to do. Those are very, very different. One is going to be, very, very different. Would you rather do geriatrics or mental health? Don't go into mental health just for the money. I know that's where the money is right now, but those people deserve someone who really cares about them and mental health and serving that population, because we already devalue mental health so much. So please, if you go into mental health, go into it because you genuinely have a passion for that and want to help people with that, not because they pay you the big bucks. And said, really, I have to pay my own malpractice insurance too and look for my own preceptor. Guys, I am so sorry. That's a mess. In my world, this will not exist. It's just so what are we even paying for? If you have to pay your own malpractice insurance, which can't be cheap, as a student, and you have to find your own preceptor, why? And then you wonder why I won't even say it, but if we want to be taken seriously, I feel like things need to change. And then you wonder why people aren't taken seriously. And it's because of things like this, because those schools are just farming money and not having to do anything. Aren't you glad you're here? I'm just angry ranting at everyone. Let me see. Nurse Nice says, yeah, I have to find them, but only if they can't, they will help you, but you absolutely have to have exhausted all avenues. That's just what a mess. And I've even heard of some schools saying that they will help you if you've exhausted all avenues, and then that never ends up happening. You know what I mean? Their help is oh, well, here's a sheet of paper with some of the clinics we've been able to do before. And it's no. That was someone's full-time job at my school was to find preceptors, because it is a full-time job. And we all helped a lot too. Everyone, I feel a lot of people tried to find their own too, because it was just, even as a full-time job, that person couldn't keep up with it. Haley, I want to get my psychiatric mental health NP one day. Please do. We need so many more psychiatric mental health or just mental health providers in general. I have the hardest time getting my patients to be able to find a psychiatrist, and we have no psych NPs in my area. It's just such a bummer. Henry, yes, please go and then move here and take care of my patients because we have so many and they need you so bad. Sunny said, thanks. School doesn't know if they will have clinical, but I'm happy to at least get this. Happy to debate Jerry versus mental health. Good luck. I know you can make an excellent decision. Bai Shua, sorry if I said your name wrong. How has COVID affected your job as an NP? I've learned many NPs are furloughed at the moment and have been having a hard time finding jobs just for my circle of friends. So my job is private practice. So it's different. I know people who work at larger institutions, a lot of people got furloughed because either jobs didn't know how to couldn't be open because of, maybe the specialty they were in, was not needed or not considered essential, or telemedicine hadn't been totally rolled out yet. My job, I work super part-time. I think if I had worked more, I would have had to cut my hours would have been cut back because we just did not have the patients that would have been able to support paying me. we're back now at like enough capacity where it makes sense for me to be there. But even now, like I'm still like not as busy as I was before all of this. But I'm busy enough that like we're kind of breaking even with me existing there. We see like half in the office and half over telemedicine. So that's been like the biggest difference. But it just, so the way a lot of people are getting furloughed because our healthcare system, the money is based in the hospitals. So inpatient procedures, surgeries, procedural based and hospital based medicine is what's reimbursed the most. A lot of surgeries specifically are reimbursed the most. So they are the money makers of the healthcare system. So if surgery is on hold and a lot of elective procedures are on hold and the hospital is not making money, because primary care does, and like outpatient clinics they drain healthcare systems of money. Because if you look at like what insurance companies will pay for a visit in an office for primary care versus like a procedure or a hospitalization, it is so much more geared towards like what they call tertiary care, or like the end of the road. So there's so much more money going into hospitalizations versus like preventative care. So that's why people are getting laid off. And I think that's part of a huge misconception of people like, it can't be that serious. Like all these healthcare people are getting laid off. They're getting laid off because there's no money, because the things that bring that, because our healthcare system is so upside down that the money is like, rather than, we should fund it primary care so that hopefully we use less hospitals, but it's built, let's pay the hospitals. And then it's so backwards, but that's why there's not as many jobs and all of that is happening, because you're getting furloughed and NPs are losing their job because there's no reimbursement there, essentially, because the hospitals are cutting their, they're like, oh, well, you're not bringing in money, so we're just going to axe you, which is just like, and then it's going to just create more of a problem, because then everyone's going to end up in the hospital and it's just such, this has been this was part of my like mental, like today, I was just like with the insurance companies and like, I was like, poor MAs guys, they were just like, what, I was going off about this. I was like, and if I worked in like, oh my gosh, those poor girls. Oh, what a mess. Now I missed a bunch of things on my angry rant, but that is why nurses are getting, and nurses too, are getting furloughed, because nurses are not money makers. Nurses are money spenders. So it's just a mess. So yay. I feel like Kim King was saying it's a full-time job finding preceptors. They find our preceptors in our FNP, but they're struggling to keep clinical sites due to COVID. I know, it stinks. Jess said, my nurse is a full-time float, and her and all the other float nurses got furloughed for so long, she feels like it's basically fired. Oh, that just sucks. Kim, I'm sorry you're in your boat. I dedicate 1.5 days of the week during office hours to make calls and then work on homework and studying an hour and a half a week. Oh my gosh, guys, this is just like so sad with all like the clinical situations. Julia Trite said lots of posting on Reddits from NPs being furloughed or losing their positions. Others finding positions through agencies. Person sometimes have needed to do a 13-week contract to do locum tenens. So that's like, kind of like travel nursing, but for providers. Kurt said, are you allowed to go independent in your practice? So I do not live in an independent state. However, I pretty much, she's not like looking over my shoulder all the time. The woman I work with, she reviews some of my charts as is required by North Carolina law, and just to like see and make sure I'm not doing something off the wall. But I have a lot of autonomy in terms of like what I would like to do, especially with patients who I am there. We share panels of patients, which is different and something to keep in mind when you're getting your job. Do I have my own panel or am I sharing? I think sharing probably only really happens in private practice. But there are patients who they have seen her like once, because I think they have to see her once, but who have mostly seen me, and she gives me pretty much autonomy in terms of, unless I have questions or like I ask her questions all the time, but you know what I mean? Like I really get to kind of guide that. So, there's a lot of people really, I don't, I don't know. I have a really, a different opinion on like the whole independent practice thing. In my experience, it hasn't been bad. Like I have not been limited by having her there. I've really only been helped. I would not have felt safe going out on my own independently. Now I still can't even fathom it. So I think people really always like approach, oh, I live in a independent or a non-independent NP state. And it's not like it's not like you have someone watching over your shoulder all the time. I'm sure other situations, like it's different, but in most situations, like you have a lot of autonomy. And it's really not this thing that everyone likes to make it up to be. Yes, in some instances, it would absolutely make more sense it would be very beneficial for NPs to have independent practice in some aspects. I'm not saying that. I'm just saying like, I hear so many people approach it with like, oh, it's like, I live in this state and it's like not independent. And it's really not like, it's honestly not like something I honestly ever really even think about. Something I'm considering when becoming an MP, answering to my question, road to AGCMP, extremely upside down. You get more money to do things to patients instead of preventing things. That's so true. You get way more money for like procedures, anything like that, versus like if you bill, this is going back to like billing and what you get paid for. Versus like an appointment with a newly diabetic patient, like why don't we emphasize paying more money, like really encouraging providers to do those education appointments. Like, hey, you're a newly dosed type 2 diabetic. Let's set up 3 or 4 appointments. And at one, we're going to talk about just diet. And at the next one, we're going to talk about what this disease process looks like. And at the next one, we're going to talk about like risk factors that we need to control and what your care is going to look like. And hey, like, but we don't pay for that. So it's not happening. So we're ending up in the hospital. And it's just like, we need to emphasize, that's what we need to do. Switch the emphasis and like reimburse people for their efforts of preventative care versus getting out. Anyway, reinvited my my anger towards all of that. Bao said, yes, my workplace had to lay off 2 nursing staff and we are now worried about working with short staff with increased patient appointments. Yeah. And that's the thing is like, and now the hospitals are like, oh, well, now we're back up and running. So you just need to like make up the lost time. I've heard a ton of NPs who are stuck now. Like one, you might've lost your MA or you lost your nurse and they're double booking all these appointments. And they're like, well, we'll just make up for lost time. And it's just like, that is not how, like that's only going to hurt people in the end too. And you're going to burn out your employees that you already have. But then, oh, guys, it's just, I feel like this was not good. I'm like, why are we doing this? What is happening? I promise there are usually good aspects of these jobs. I promise. I don't want to like discourage anyone, but I also want to be real because I feel like this is stuff no one talks, you know what I mean? No one talks about this because everyone wants to be like, oh, everything's great and perfect. And right now it doesn't feel great and perfect, to be totally like transparent. So I'm sorry if that discourages you. I'm not trying to discourage you. I work in outpatient surgery. When we were doing surgeries, we were losing 10 million a day as a system, and we had tons of furloughs. Ugh, that is a ton of money. No one talks about the politics of nursing. Here we are today. We are right now. Our PRNs have barely been getting hours, but then our full-timers get called in because we weren't low enough census not to have PRNs. Oh, that's a mess. At my nursing school in Texas, they've considered students essentials, so they've been able to keep our clinical spots. Oh, that's kind of nice. And wasn't Texas one of the states that like released the poor new nurses like to the wolves? Like was just like, oh, it's fine. Like you didn't really finish nursing maybe it was that you didn't pass the NCLEX and go. I just feel so bad for those people. If any of you are those people, how awful would that be as your first job? Like, oh yeah, just go tackle coronavirus. Like, no, no, that was rude. How did you negotiate your contract with the doctor you work with? I'll make a video about this. Not well. Not well at all. I didn't get to really negotiate it. I tried and then they said no. that's about that. Oh man, there's someone on Instagram. Why can I not think? Give Me More Monica on Instagram has a course on just on contract negotiations, and she is your person for that. I'll write her. Give Me More Monica. That's going to be her because I completely failed. Just completely failed. So I'm more than happy to write a video or make a video on like what I tried to do and things that I've learned and I will do differently the next time I go to do all of that. But I basically just asked for more money, but I also am in a position where my position is very part-time, and I was negotiating. I have a lot of lifestyle benefits. So like I have like very flexible time off, and I obviously work like very part-time. So that was also, you really have to evaluate before you go into negotiations what is important to you, because you could always negotiate more time off or more money or anything like that. But I highly recommend her. She has a lot of really good resources. Sarah said, hello, I just graduated from nursing school and passed the NCLEX. Oh, congratulations. I start my nursing career in 2 weeks. So you have a job and you just passed the NCLEX. That's amazing. Congratulations. Let me see. Yes to the contract video. Road to AGP, CMP. I feel like you should make a contracts video. I feel like yours would be way better than mine. All right, we'll do a couple more questions and then I think I'm going to head out. I'm going to go exercise because I obviously have a lot of pent up anger that I need to go take out somewhere other than you. So I apologize for any misplaced ranting or anger, anyone who I've discouraged. I really wasn't trying to discourage anyone. Kara said, hi, I'm planning to start my prerequisites for nursing school. Should I wait due to COVID? I work full-time at a hospital currently doing coding and I'm only 21, so it wouldn't kill me if you could always wait and see. So I get the question is kind of like, should she start now knowing I think that, you might not be able to get in for clinical and all of that. But I feel like that's far enough away. Like, we're going to have to figure something out here in the next year. Nursing school can't be like that forever. Maybe it will be, who knows? But you know what I mean? Like, you might as well start your prerequisites because they're going to figure out something and they're going to have to figure something out. So I would just go for it and start your prereqs and cross your finger. Like, you know what I mean? By the time you get to nursing school, they better have something figured out. Julia said, independent practice happens in my state after 2,850 hours of NP practice under physician supervision. Do I have my phone? I need to calculate how many hours of full-time practice is that? Let me look. Please pause. 2,800, as if like my opinion is going to change this. This is already a law. And I'm like, I don't agree. Divided by 40. Is okay, so that's like 71.25 weeks. So more than a year. Okay, so that seems like better. That's good. I feel like there at least needs to be that. Some states there's not, and it just scares me. I'm like, how do you pop out and be able to like open your own practice? That's just but yeah, I feel like that's okay. That's at least. I wish it was more. I won't lie. I feel like, I don't work full time, so I don't have that, but I feel like it should at least be the number of hours, like 3 years, you know what I mean? To kind of equal a residency, if we're looking at it like that. I feel like most of us would probably go into it with the good intention of like, oh, I'm only doing this to serve people well. But there's going to be people who would take that and be like, oh, I hit my hours, and then go out and make some not so great choices that are going to really negatively impact the rest of our profession, which, as we've already discussed, doesn't necessarily already have the best perception because we don't find preceptors and yeah. Sarah said, I got accepted into a Georgetown University FNP MSN program. I found out yesterday. Congratulations. That's so exciting. I feel like we've talked about that before, that you were like applying or something. So I'm super excited for you. I have worked with people who have gone there before, and it's a hard but a good program. Rage on the Peloton. That is literally it. I'm going to go find and be like, what playlist here? Who has a ride for me? Is there a ride for like angry people? If not, like, can you request those? Be like, get a little bit of your anger out. Does anyone use the Peloton, and what instructors? All my instructors usually like Peppy. Like I really like Tunde and Cody. Those are my two go-tos, Tunde and Cody. So is anyone more angry? Because I feel like I need that today. Tunde would just be like, everything is great and wonderful. You're so pretty. And I'd be like, Megan said starting nursing school in a couple of months. Am I risking my family's health being in a hospital now? I mean, like honestly, yeah. Like, yeah, if you're working in healthcare at all, you are at more risk of exposing yourself to it and having your family be at risk to it. But that's anyone in healthcare. What time is it there? It's 9:35 in Florida. That is also what time it is here. Hi, I just graduated in December with my ADN. Congratulations. And got hired on a trauma PCU floor. Congratulations. I'm so nervous about being so far out of school. Any tips? Yeah, they'll train you. They'll train you. You'll be fine. Just go in with an open mind, willing to ask questions. You'll be okay. They'll train you. I'm sure they will. Your first job trains you. So like, just if you go in with an open mind, willing to learn. I have a video, I think, for new nurses. You can go watch that. That might have some more insightful things, but they'll be okay. The first jobs, I feel like, do a good job kind of enveloping you and training you, especially on so you were in trauma. They're going to really, they do a good job there. Okay. All right. I think I'm going to go rage on my Peloton. Thanks everyone for being here. Sorry, I got a little bit ranty and angry. That was not the goal. But whew, here we go. It's all going to be fine. I certainly hope. Thanks for being here. We'll do another one in another 2 weeks. We'll try to be a little bit more, I'll try to pick a little bit of a lighter topic, maybe. If you have any suggestions of a lighter topic you would like a little random tangent about, please leave it below. Like, I don't even know, cute babies, or I don't know, like anything that is less angsty would probably be much appreciated. But anyway, guys, thanks for being here. I hope you have a lovely week. For real, leave topics if you want any topics. I like to do ones on here that are like not something I could make a full video out of, but you know, something we can rant about a little bit and all come together and have a communal rant on it. So any topics would be appreciated. I enjoyed Sassy Liz. I feel like I'm getting sassier and sassier on the internet, and I should probably like calm down. All right, guys, have a good night. I will see you later. Bye.